Hey everybody, this is Kevin McFarland from The Art of Emergency Nursing, and you're listening to 30 Days to Being a Badass ER Nurse. In the next 30 days, I'm going to give you some quick tips and tricks to help you be a better ER nurse. And of course, as always, it's not just me you're going to hear from. I've recruited some of my friends to give you some of their tips and tricks so they can share their knowledge as well. So don't forget to subscribe so that you catch all the episodes. And if you find one of these tips and tricks are really helpful, give me a shout out on social media and share it with your friends. Let's get into today's tip. During this 30-day challenge, I'm going to dedicate my tips and tricks on Saturdays and Sundays to pediatric tips, because I know not all the nurses out there in the world are comfortable with taking care of pediatric patients. For today's episode, I'm going to give you 10 tips to make your pediatric IVs go better. Tip number 1 is that the PEDS IV is a team sport. Always bring a buddy when getting ready to start a pediatric IV. When I work in the PEDS ED, we almost always tackle a PEDS IV as a team. That brings me to tip number 2. The most important person in the room is the person helping you hold the patient. That's why it's a team sport, is the person you're holding becomes critical. Make sure you know how to hold the patient and keep them from wiggling the best you can. Tip number 3 is with pediatric patients, start low in the extremity and work your way up. And when at all possible, look at all 4 extremities before committing to a location. It never fails that when I start a pediatric IV, if that doesn't go well, I go to the next extremity and I find a big honking vein. Happens almost every time. So make sure that you look for make sure you look at all 4 extremities before you commit. Tip number 4, if at all possible, give the pediatric patient choices as long as both choices are your choice overall. For instance, if you see a great vein in the left and the right hand, give the child a choice. Ask the child which side they want you to put the IV on. Tip number 5, not all pediatric patients need a 24 gauge IV. If you have an 11-year-old kid with great veins, you certainly don't need to put a 24 gauge IV in that. Don't be afraid to go a little bit bigger. As you guys probably already know, oftentimes the bigger catheters go in a little bit easier than the smaller ones. Now, so don't be afraid to use something with a little bit of size. Now, with that said, I'll tell you that a functioning 24 gauge beats the hell out of a 22 gauge any day. So don't get over ambitious. For tip number 6, when it comes to pediatric IVs, being able to recognize a sick and dehydrated child is critical. You always hear the old phrase, sick kids look sick. That's very true, and oftentimes the sick that you're seeing is dehydration. Some of the symptoms of dehydration that you need to be aware of is irritability, lethargy, cool dry skin, a sunken fontanelle, dry mouth, sometimes sunken eyes. You have to ask the parent about the number of wet diapers over the last 24 hours. Most babies should have between 6 and 8 wet diapers every 24 hours. Some may have more. If they're having much less than that, it's something that you may want to investigate. Dehydration is a big deal for pediatric patients. The good news is it can be managed quite well with some fluids. Number 7, when starting a pediatric IV, one of the things I always tell people is that the angle of insertion is much lower than it is for adults. When I'm getting ready to start an IV, my angiocath is almost flat, and I go in with almost a scoop motion when I actually pierce the skin. This should keep you from going through the back of the vein. Tip number 8, once you have the IV established, your only priority is to get that IV secured. Before you do anything else, don't attempt to draw blood, don't attempt to start the fluids and run the fluids until you get that IV secure in a pediatric patient. Even if it's just a simple slice of tape across before you put your tegaderm on, you got to get something to secure it to that patient. Those things can fall out so easy, especially when you're talking about those short little 24 gauge angiocaths. So again, secure it as quickly as possible. My friend Sally Snow gave the tip of securing the patient to the arm board before you start the IV, and that's a really great tip. Not only does it help immobilize the child, but it gives you a little something extra to hang on to. For tip number 9, I have a little bit of bad news for those of you who do your IVs by feel. With these chubby little kiddos, you may not be able to feel the veins that you're used to feeling. You may have to look for the veins and look for those little blue lines running down the center of their hand. IVs and the AC of your chunky little monkeys might have a little bit of bounce to them, but you may not always be able to feel those veins. Get used to using your eyes on those kiddos. The last tip I'm going to give you for pediatric IVs, tip number 10, is that don't try to be a hero. What I mean by that is if you're not successful, don't be afraid to ask for help. Don't be the nurse that pokes a child 3-4 times, blows all the good veins, and then calls somebody after for help. My personal limit on pediatric patients is typically just one poke, but in some cases, I'll give it a second shot. But if there are other experts there, don't be afraid to call them. Again, like I said, a team sport. I really hope these tips help you next time you're getting ready to start a pediatric IV. If you have any tips to add, feel free to comment on this podcast or give me a shout on social media. That's all for today. Thanks for listening. We'll catch you tomorrow. Have a good shift.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.
For tip number 6, one of the things you need to be able to do is recognize a sick child when you see one. You always hear the old phrase, Jeez Louise.